hyperglycemia and then the circulation is achieved. This is called pituitary diabetes. Now we have three types of diabetes. One is adrenal diabetes, other is pancreatic diabetes, third is pituitary diabetes. More common and classical, and fourth one as well, that is also called diabetes insipidus. And my dear students, it is this is my routine to tell you the literal meaning of each term. You need not to cram up the things. You just know the meaning of the medical terminology, then you the things that become more and more clear to you. Diabetes, as far as the word diabetes is concerned, diabetes, to pass more urine. Literal Greek word showing pass more urine. Mellitus means sweet. That is, the person is passing more and more urine, which is sweet after testing. Doing the Benedict's test and showing the glucose, presence of the glucose in this. So this is classical diabetes, in which the person is passing more and more urine, which is sweet in nature. And diabetes insipidus, diabetes means to pass more and more urine. Insipidus means tasteless, not sweet. Actually, the person is passing more and more urine, but is not tasteless. And this is due to ADH inappropriate syndrome. ADH inappropriate syndrome. As a result of that, our posterior pituitary gland that is not releasing ADH hormone in ample amount to act on the distal tubules of the renal tubules to act and to absorb more and more water. So this is ADH is not being released from the posterior pituitary. The person suffers from diabetes insipidus due to ADH inappropriate syndrome. But classically, if the person having some tumor, functioning tumor in the adrenal cortex, then adrenal diabetes is manifested in the form of hyperglycemia and their other effects on the human body, and this is called pancreatic diabetes. If the beta cell mass is decreased due to any reason, then we see that if that is being manifested after the age of 40, this is called type 2 diabetic mellitus, also called NIDDM. NIDDM. That is non-insulin diabetes dependent diabetes, and if it is being manifested after the age of below the age of 40, this is called IDDM. IDDM, that is insulin dependent diabetes mellitus, where insulin is necessary to make the person survive and to live healthier life. This insulin is required. If due to some pituitary tumor in the form of craniopharyngioma, more and more this growth hormone is being released, more and more we see that as a result of that the pituitary diabetes is seen. Now the question arises, my dear students, how to differentiate these types of diabetes. Very important clinically and as far as examination point of view, this is very important to differentiate the three types of diabetes. It has been seen that we introduce insulin test. the three types of diabetes, that is classical diabetes, that is pancreatic diabetes, pancreatic diabetes mellitus. Once we give insulin, that is very much sensitive to insulin, and the hyperglycemia is controlled. As far as adrenal diabetes is concerned, adrenal diabetes mellitus is concerned, after introducing the insulin test, it is mildly, partially response to insulin, and as far as the pituitary diabetes is concerned, no response at all. No response to insulin. So it is very important to differentiate between three types of diabetes. Number one, I told you that in order to differentiate the classical diabetes, we introduced the pancreatic diabetes maximally responds to insulin, while the adrenal diabetes partially responds to insulin test, and pituitary diabetes in the form of craniopharyngioma or growth hormone excess. And in this way, we see that once we introduce this insulin, no response, virtually no response is coming in the pituitary diabetes. So this is very important test clinically to differentiate three types of diabetes. So this is normal physiology, and now we are discussing the applied aspects of this hormone. Again, they are frequently seen in our clinical wards and everyday life. That is, as far as you see that hydrocortisone or cortisol level, they are as is the case with each and every hormone of our body, that either they are hyper functioning or hypofunctioning. Hyper functioning or hypofunctioning. So if they are functioning within the physiological range, then we see that the normal physiology is restored. And if they are hyperfunctioning, like hydrocortisone excess, that is seen, more and more cortisol level in the blood is seen, and this is called Cushing syndrome. Cushing syndrome, this is the functioning tumor, mostly caused by the functioning tumor of the adrenal cortex. As a result of that, the person suffering from this has moon-like face, slit-like eyes, and buffalo-like trunk. Buffalo-like torso or trunk. That is in the form of hyperglycemia. The patient is also diabetic, having more and more glucose level in the blood, and due to fat deposition in the central trunk, the buffalo-like face, moon-like face, that is more protein, fat deposition over the face. The patient's face become moon-like due to salt, water, and fat deposition over the face, become moon-like, or again slit-like eyes. this superior and inferior aperture, and the slit is become narrow and slit-like face, and this abnormal free fatty acid fat that is in Cushing syndrome, that is deposited over the central trunk. As a result of that, buffalo-like torso develops in Cushing syndrome, and this is mostly due to functioning tumor of adrenal cortex. Functioning tumor of adrenal cortex, this is seen. As a result of that, we see and we investigate the cortisol level, increased cortisol level in the blood of the person is present suffering from Cushing syndrome, and the person is diabetic as well. More and more insulin is being deposited, more and more free fatty acids, they are deposited in the central trunk, leading to central obesity. That's why the moon-like face, slit-like eyes, buffalo-like torso that develops, and such persons, they are diabetic and they are more prone to develop infections. As a result of the remedy or treatment of this Cushing syndrome is concerned, the remedy is the treatment of the cause. Mostly the treatment of the cause is functioning tumor of the adrenal cortex. So removal of this is the sign of remedy, that is removal of functioning tumor. In this way the things are settled, and again the person is brought to the normal glycemic control, and the person becomes normal. This condition of moon-like face, slit-like eyes, and buffalo-like trunk, that is reverted to normal. This highlights the hypersecretion of the hormone. Other condition, very important, very frequently seen in the clinical world, is Addisons disease. Addisons disease. Addison was a patient in whom first time this disease was diagnosed. This is called Addisons disease, in which there is hyposecretion of the hydrocortisone, hyposecretion or hypofunctioning of the, leading to the condition in which the cortisol level is decreased. Cortisol level in the blood is decreased, and as a result of that, the person is prone to develop more and more infections and susceptible to infection, and there is other feature is low blood pressure. Blood pressure drops due to low circulating level of cortisol in the general circulation, and as a result of that, the person feels vertigo or giddiness. सर को चक्कर आते हैं, ब्लड प्रेशर ड्रॉप हो जाता है। पेशेंट कहता है जब मैं खड़ा होता हूँ तो आंखों के आगे अंधेरा आ जाता है, ब्लड प्रेशर ड्रॉप कर जाता है। और जब हम पेशेंट को क्लोजली मॉनिटर करते हैं तो देयर इज हाइपर पिगमेंटेशन ऑफ स्किन। तो हमारे स्किन पर ब्लैक डॉट्स डिपॉजिट हो जाते हैं और वो हमें हेल्प करने में डायग्नोज करने में हेल्प करते हैं। तो इस तरीके से हाइपर पिगमेंटेशन ऑफ द स्किन इज सीन। Along with this, the patient is lethargic and less compatible with coping facing the stressful situation like infections, surgery, or some roadside accidents in which the tremendous amount of the cortisol is released, to cope up this emergency situation. And in this condition, the person is not facing any, not capable of facing the stress, the surgery, roadside accident or infections in the body. As a result of that, the immunity of the person suffers. The person, and one thing important as far as the infection, the actions of the cortisol is concerned, that as far as that depresses the protein metabolism, so they are a high level of cortisol also depresses your immunity, because the messenger RNA is not being formed in ample amount. Protein synthesis is not taking place. As a result of that, the free amino acids and they are not available at the endoplasmic reticulum to act and protein synthesis to take place. As a result of that, immunity is also decreased. So such people are immunocompromised. As far as the cause of Addisons disease is concerned, we see that this is tuberculous destruction, mostly atrophy, that is the size of the adrenal cortex is decreased. Atrophy becomes shrinken in size, and atrophy of adrenal cortex is seen. There is tuberculous destruction. Of adrenal cortex is seen. As a result of that, we see that the adrenal cortex mass is decreased, hydrocortisone from the zona glomerulosa is not released in ample amount. As a result of that, we see that due to atrophy of the adrenal cortex, this person suffers from Addisons disease, and which highlights the low cortisol level, glucose level is decreased, free fatty acid level, amino acid level is decreased, cholesterol level is decreased. As a result of that, fluid and water absorption is less, and as a result of that, your systemic blood pressure also drops. And so the person complains of vertigo or giddiness. तो मरीज कहता है कि जब मैं खड़ा होता हूँ या होती हूँ तो मुझे चक्कर आते हैं, आंखों के आगे अंधेरा आ जाता है, और इस तरीके से अगर वो इन्फेक्शन हो जाए तो the person is not able to compromise infection or compete the stress of infection, and in this way total physiology is derailed and enters into the pathology, and in this way, as a result of that, we see that this person suffers, is more prone to develop infections. And as far as the remedy, diagnosis of adrenal cortex Addisons disease is concerned, the test which is done is the cortisol level in the blood cortisol level. We estimate the blood cortisol level, which is in micrograms, and as a result of that, we see if that is below the normal limits, and also correlating with the clinical picture of the patient, we see that the person is suffering from Addisons disease, and its remedy is to give cortisol tablet, 5 mg cortisol, which is available in the market for whole life, and the person is combating leading normal lifespan because there is deficiency of the cortisol due to hyposecretion of the cortisol level due to the condition which is called Addisons disease. So cortisol level is decreased. As a result of that, we give exogenous cortisol in the form of prednisolone or delta-cortril or prednisolone, that is given 5 mg per day, and in this way the person is able to lead normal lifespan. Last point which I missed is is that you might have seen a heart that each and every hormone in endocrinology, that they have the specific timing for the release in the day timing, that is called diurnal variation. Hormone level, blood hormone level. And this is time duration. This is 4 a.m. This is 12 noon. And this is 6 p.m. We see that this hormone, like this, early in the morning at 4 a.m. the level of the cortisol is less. As the day passes and progresses towards noon, 12 noon or 1 p.m. its level is more, and as the day passes more further towards 6 p.m. its level declines. This is how and in emergency situation, if someone is facing difficulty that is in the form of infection, stress, you have exam stress, you have corona stress, you have surgical stress, surgery, or roadside accident, or other infections in the human body, its level increases like this. To combat the stress and emergency situation. So in this way, it has been recommended that in corona, where the vaccination is being formed in the trial stages, it is claimed that Russia has synthesized the vaccination of corona, but still this cortisol level, that a delta cortisol or prednisolone is a declared drug of choice by Minister of Health Pakistan. Minister of Health Pakistan, it has been declared the drug of choice to combat the corona patients. This is all about your actions of the cortisol level, and I hope you will read Guyton and Grom and to build up your knowledge, and any queries or questions, they are always welcome. I always welcome my students to come up with good questions. And it is said, it is in Arabic, a good question is half knowledge. अच्छा सवाल आधा इल्म, ठीक है? आप क्वेश्चंस के साथ आए, you are always welcome. किस किस्म की कोई इंक्वायरी है, किस किस्म का कोई प्रॉब्लम है, you are always welcome in my office, in the Department of Physiology. So good luck to you. आप पढ़ें, और हमारा मैसेज ये है कि आप अच्छे डॉक्टर बने और अपना भी नाम रोशन करें, वालिदैन का नाम भी रोशन करें और इंस्टीट्यूशन का नाम भी रोशन करें, और उसके बाद आप जो है इंसानियत की खिदमत करें। कुरान पाक में आता है 6 पारे में अल्लाह पाक ने फरमाया कि वमन अहयाहा फकअन्नमा अहया अन्नास जमीआ, अगर किसी ने एक जान को बचा लिया, वो है कि उसने पूरी इंसानियत को बचा लिया। He who saves the life of a single person, he has saved the life of whole humanity. तो आप अच्छे डॉक्टर बने, अच्छे अप्लाइड एस्पेक्ट देखें, ये बड़ा इम्पोर्टेंट हार्मोन है, और जहाँ दूसरे हार्मोन, ग्रोथ हार्मोन, आपका इंसुलिन और दूसरे हार्मोन की सिग्निफिकेंस ह्यूमन बॉडी में है, तो ये इमरजेंसी हार्मोन इस वजह से कहते हैं कि इमरजेंसी सिचुएशन में आपकी हेल्प करते हैं। तो आप अच्छी तरह पढ़ें, गाइडन एंड गुनोम, यू मेक योर कंसेप्ट्स क्लियर, और अगर किसी किस्म की कोई इंक्वायरी है, कोई प्रॉब्लम है, तो you are always come to my office. तो मेरा contact number भी आप note कर लें 033 60 56674 is my contact number. If you tell the name and roll number and tell I'm second year medical student of KIMS, you are always welcome these questions, and we also encourage being a young scholar and young scientist. We always welcome your questions, and inshallah I will try to satisfy your questions. Good luck. Assalamu alaikum.